Concession. This word became very pronounced in Nigeria's economic lexicon when the government came up with a new initiative to save public institutions from total collapse. But the idea was heavily criticized by those who saw the policy as a move to sell what was described as Nigeria's heritage to a few individuals.
But concessioning of public properties was an answer to a public outcry against outright privatization. This idea was acceptable to government and tolerable to the public at that time. So far, airports, roads and steel companies have been concessioned to private organizations. In 2006, the Federal Capital Territory Administration took a cue from the federal government and decided to hand over the management of some of its medical centers to private organizations. The first to go was the Garki General Hospital. Dr. Ibrahim Wada is the medical director at Nisa Premier. His hospital won the bid to manage the Garki General Hospital.
I knew that Nigeria had reached a point when she should experiment with a new way of doing things.
For people like Wada, they believe that the management of hospitals cannot be left in the hands of government alone.
Healthcare infrastructure, if you want, suffering from a poor maintenance culture, was never returning to the nation benefits. They were going down.
The healthcare challenge in the FCT is enormous. While the territory enjoys some public acceptance of its health policies, the administration still has a lot to do as far as primary and secondary health care is concerned.
When we started with Garki, we started with Maitama, we had Asokoro districts, we had Wuse. So all of those had general hospitals at inception. But now FCT has well over maybe 12, maybe 14 districts that are in place. And we still don't have hospitals in those districts, but a lot of efforts are going on.
But do you know what? We have only about 420 primary health care staff to man 220 primary health care centers. So you know that we have really a lot of gap to handle. So people have no confidence of going there.
This situation has again raised concerns, and there is a debate about government's ability to run and manage its own institutions, especially healthcare facilities. Some even imply that the whole idea of concessioning is an avenue to defraud the nation.
When government are into production, it is an avenue that they steal money. They can say they are putting billions in this hospital now, and when you go there are no drugs.
Let government handle it themselves because it will be better.
After painstakingly and eagerly watching the construction of this hospital for years, residents of Karu, a suburb of the FCT, were shocked to see the sign Primus International Hospital erected rather than Karu General Hospital as expected.
Formerly, everybody believe, example as getting Metama General Hospital or Sokoro General Hospital, this one which will be General Hospital belong to Karu and the access area.
It is government that's supposed to hold this in so that we poor ones that living in this area can benefit from the hospital.
Beyond all the hue and cry about the cost of concessioning or privatization of government health institutions in the FCT, there are obvious benefits that are clearly seen and experienced as patients who would have gone abroad to seek medical attention can now get this attention at home.
When I came to the orthopedist doctor, surgeon, the man is something else. He can even raise a dead person.
My wife has a problem with her leg, and they are treating her very perfectly. I wanted to take her to the South Africa.
During our investigations, we learned that the hospital was not concessioned but leased to some Indian health practitioners.
The Honorable Minister, Mr. Ilero, was the FCT Minister, and we spoke to him, we gave him the proposal, and he was very impressed with the proposal because as so many Nigerians, they are visiting India and other countries for their medical. So he was very much interested, so he offered us this building. And that's how we took this building. This is on lease. The
Managing Director, FCT Hospital Management Board, explains that 40% of the hospital was leased to Primus International Hospital, while 60% of the hospital will maintain its original status as a general hospital. The problems of public health care facilities are clear. Analysts say so are the solutions.
In these concession issues, what we should identify is how can we protect our citizens from paying out of pocket, period. And health insurance is the answer. NHIS has led it. I believe the banks now are coming into it for private healthcare insurance.
The FCT administration admits that the issue of hospital concession is an experiment. It is waiting to see how effective or ineffective the policy will be. One thing is clear. Government has never been rated highly where management of public health is concerned. Stakeholders say it is important that Nigeria does not go back to the 80s when hospitals were regarded as mere consulting clinics. Senami Ohiomokhare, AIT News, Abuja.